Okay, so a typical day on West State as a nurse. So usually we start at 7 a.m. We get reports from the nurses, and we also have a huddle at 7 o'clock as well. So it's kind of like the whole unit gets together and we go over any issues, if there's any issues or anything, and recognition of any employees. And then after that, we get report, like I was saying, and then start off our day. Usually med passes and assessments start around 8-ish. We typically start with 4 to 5 patients, just depending on the, how many nurses we have on that day. And the doctors usually come and they round from 8:30 on. It just depends, but usually they start around 8:30. And the coordinators with the doctors will call the nurse of that room and say, hey, we're rounding on this patient. Would you like to join us? We all go in and we go over a list with the doctors about medications, diagnosis, why the patient's here and why they're still here, if they're going home today. Patients have questions they ask then. And then, so we try to do all our rounds with the doctors at that time. And usually the doctor is willing to try to go with that same nurse. So the same nurse can kind of hurry and get her rounds done so she can continue doing patient care and any, call-outs or medications that need to be passed. And then usually in the afternoon is when we usually do discharges. It's usually early afternoon. And if you have, say you have 1 to 2 discharges, you discharge your patients, and then once in a while you'll get maybe an admit, 1 to 2, it depends on the day again and how busy the ER is, or we get patients from transfer centers, which mean another hospital that needs to come in for certain things on the unit. And then, yeah, pretty much just continue to round on your patients. We round every hour and continue to do that until we have more admits or if we get to go home. So